Hello, I'm Dan DeRosa, GP from Warstones Health Centre in the southwest of Wolverhampton. Well, a GP basically is your family doctor. In the long term, we look after patients with short-term illnesses, emergencies, and also people with long-term conditions such as diabetes.
How can people access a GP?
Right, well, first and foremost, you need to be registered with that general practice really, so that's important, because if you're not registered, the GP cannot look after you on a regular basis. They can provide emergency treatment, but not regular ongoing treatment.
If you or your loved one is ill and you need to access healthcare on an evening or a weekend, what should you do?
Well, first of all, you can check on your practice leaflet with your surgery, because quite a few surgeries now are offering extended hours when they're open later at night. If they're not open, then if you ring the surgery, they will give you a number to ring to contact the out-of-hours provider. If you can't access your local GP service at the practice, then there are other alternatives such as walk-in centres, which tend to be open till about 8 at night and also through the weekends.
What other services might you find at your local doctor's surgery?
Well, these services will vary according to the practice, really. It depends on the size of the practice. Some practices do investigations such as ultrasound scanning for various problems, and also they provide extended contraceptive advice and care.
So when should you make an appointment to see your GP?
If patients are in doubt, they should always ring up for advice really. That can be done NHS 111 or the surgery. Generally, we'd like to see people who've had persistent symptoms. Say if they've had a cough and that doesn't appear to be settling after they've tried simple remedies from the pharmacist. If people have had sort of falls or injuries, and also people who've got chronic conditions, and if they've got worse, they feel they're getting worse, it'd be useful to see those so we can manage them more effectively.
When is it best to see a pharmacy or perhaps stay at home to get better?
Well, we would consider these as like minor illnesses that can be managed either by the patient by looking after themselves at home or by seeking advice from the pharmacy. So examples would be cold sores, minor coughs and colds, things like children with nappy rash. If in doubt, patients can go to the pharmacist, they can get the advice, and if the pharmacist isn't happy, they can always direct them to the GP.
When is it best for someone to seek more urgent care for an illness or injury?
Well, it's in clear-cut examples such as sudden onset chest pain, which could mean heart problems. You could have severe breathing difficulties, and also following injury where people might suspect they've broken a limb, or where there's quite a lot of bleeding or loss of consciousness. All these areas are where you need to seek urgent care. If people are in doubt, we have a useful service in NHS 111 which will actually listen to them, gauge the situation, then signpost them correctly really, whether they need to call an ambulance or send an ambulance to them, or whether they can go to the GP or they're actually to the emergency department.